Williams is a clinical mental health counselor in Lane County. He joins me live by Skype right now. And Ben, as a therapist yourself, what has your experience been so far since this outbreak started, as far as your job, seeing and hearing from your clients, and making that switch to telehealth?
Hi, Brian. Yeah, thanks for having me. I think that I've noticed most that people are largely resilient. Therapy is about a connection between the client and the therapist. And it's not that telehealth or video or phone call counseling are necessarily better or worse, just a different connection. But we're kind of all in this together. So I've noticed that people are kind of buckling down and saying, okay, this is different, but my mental health is important. So largely I've seen people be pretty resilient and make the switch, because we're all kind of finding a new normal as we go.
Right. And on that telehealth topic, how have you seen this affect your day-to-day work? You talked about your clients and whether they're hesitant or not, but compare it to how you would see them in person versus how you're doing it now. What's that dynamic like?
Yeah, it's definitely different. My day-to-day has changed a lot. I was in a few offices and in schools most of the time. So it's changed a lot. But I would say that for the people that give telehealth a try, it's definitely after that initial, okay, this is our new environment, this is what we're doing, maybe this is my animal, it has actually added a little bit of a layer of vulnerability between therapist and client, like, hey, I'm in this shift with you, we're all doing this together, So I would say that once we get over the hump, it's largely the same. But there's definitely people that are like, I'm going to wait this out, I'm going to slow it down, be with my family, and I'll get back to my mental health when this is all over.
And you're also sometimes on call for emergency mental health crises. How are you handling those situations when it involves going into local hospitals where there could also be COVID-19 patients?
Sure, yeah. One thing that has really hit home to me is realizing how kind of safe and sanitary our hospitals are around here. I think hospitals are usually that way, but in a time where we're all kind of on hyper alert, I've been really pleased to see everyone in the healthcare industry really doing their part, balancing that patient care with social distance as much as we can, wearing gowns and masks whenever we can, and just a lot of extra sanitary stuff, washing, disinfecting, a lot of laundry before we even go in our houses, I think that people are really doing their part. Hospitals are keeping people with any respiratory symptoms largely away from the main areas. So I think I'm just noticing how much everyone's working together to do their part, and that, we're all kind of trying to do our best.
And obviously, people are turning to you for help and mental health and advice on how to cope with this pandemic. How do you also kind of self-counsel yourself so that you can put on that brave face and make sure that you're able to give that expert advice?
Yeah, that's a great question, Brian. I would say mostly, except for, the stuff we've heard a million times, washing our hands, social distancing, specifically to mental health, reminding myself as much as humanly possible and in as many ways as possible that this is temporary. I think it's so important to stay informed and know what's going on and stay up to date with the latest safety standards and all that. But there's also a mental health danger in overconsumption. If you go down a social media rabbit hole or just consume what's happening out there, which is pretty scary without a break, I think it can make our brains feel like, oh man, this is how it's going to be forever. So for myself, I'll go outside in a private space as much as possible, kind of see, okay, this remains largely unchanged. I'll text friends and say, hey, when this is all over, I want to do this, because I think having something to look forward to and reminding ourselves that it's temporary and that if we all do our part, we're going to get through this as fast as possible is the best thing we can do.
I have one more question for you.
Yeah.
For folks out there who may not have sought counseling before but kind of feel like they need someone to talk to right now, not being able to see them in person, not being able to do that outreach in person, what advice do you have for people interested in seeking out some sort of mental health? Do you just Google it? I mean, what should they do?
Yeah, absolutely. So Psychology Today is a really good tool. Almost every counselor has a Psychology Today profile that says what they go after, in terms of their methodology and how they work with clients and kind of what their specialties are. And I know a lot of people, myself included, are offering, 20 or 30 minutes to say, hey, are we a match? Is this going to be a good fit? Do you want to do this? Because obviously finding that connection in person is ideal, but we can't right now. So I'd say reach out and remember that as mental health professionals, we're all in this change with you, and we're doing everything we can to adapt and serve people as well.
Ben Williams is a clinical mental health counselor in Lane County. Ben, thank you for your time.
Thanks so much, Brian.